We have Dr. Milind, and he is practicing in Pune. Also, we have the presence of Dr. Suhas, and he is being practicing in Pune.
In Nagpur.
In Nagpur, actually. Well, we're going to be talking about kidney stone management for today, and we'll be having very simple, very important questions when it comes to kidney stone management. So we're going to be starting with Mr. Suhas. Why do you think the number of cases of kidney stones are on a constant rise?
I think there are 2 or 3 factors.
Yeah.
One is the dehydration. So we live in a tropical climate where it's pretty hot, and those who are working outdoors, they sweat a lot and get dehydrated.
Yeah.
So the crystallization process that occurs, and plus I think the new age, new generation, they are quite fond of this fast food things. So there are few things which can precipitate stone formation.
All right. Anything which we can avoid, or maybe we can take it in moderation in order to avoid having kidney stone?
I think the best thing is not in moderation, but plenty of water. That's all. That's all you have to do.
That is all we need to do. Well, if you can recall any of your case wherein the patient came very, very late when it came to kidney stone, and then you did an excellent job maybe, and he's back on track. Any of such?
Yes, I mean, as a neurologist, you tend to get these cases pretty often because patient comes in acute pain, and acute pain is severe enough to remind them almost as if a delivery pain. So they have severe pain, and once you take the stone out, they are absolutely relieved immediately.
All right.
So ureteric stones are the most painful stones, and they can cause. Another most important is sometimes the stone is impacted and there is pus formation. So if there is pyonephrosis, then these are the patients who are miserable, and they can go into sepsis. So if you relieve them, they immediately recover. I mean, remove the stone, put a stent, drain the pus, and they're all right. So.
Wonderful. Dr. Main would like to ask you, in your experience, what were the major misconception a patient came to you with?
One of the biggest misconceptions about stone disease is that it can be dissolved. And therefore, in fact, that is one reason why we see patients coming in late. They keep on taking some sort of herbal medication or alternative therapies, and they're promised that the stone will dissolve and go away. And the fact of the matter is, you can't dissolve any urinary stone. Maybe small stones do pass. Of course, we also give medication to facilitate the passage of such stones. But everything needs to be done under a controlled situation. One needs to keep on monitoring these patients, because the downside of the whole thing is if the stone stays obstructed, then you'll end up in complications, what he described just now, and you'll lose your kidney in the process.
Okay. In your experience, what precaution can effectively be taken in order to avoid kidney stones and, of course, the recurrent stones?
So I think we all sing the same tune.
Recurring.
Whatever it is, it's plenty of water. And a lot of patients do ask us, what do you mean by plenty of water or plenty of liquids?
Yeah, that is important.
And usually, this is what I learned from my boss 35 years ago. Drink as much water so as to keep your urine the color of water. So that's the benchmark.
Okay, so that is the indication that you are
you're well hydrated.
Hydrated.
Well hydrated. Of course, thirst will dictate the amount of liquid we all drink. And citrus fruits can be helpful, because citrates in citrus fruits are known to prevent crystallization of stones, and yeah, that could also be another adjunctive.
Well, one question from both of you gentlemen. What do you think is going to be the next breakthrough when it comes to kidney stone domain?
I think we are in an era of technology.
Yes.
So we haven't done anything to actually stop the stones from forming. So all we do is use the technology to remove the stones. So there are a lot of new things coming up, lasers and this thing and that thing. That we break the stone, we remove the stone. We remove the stone with minimally invasive things, but we haven't done much to avoid forming stones.
So I think, what we really need to focus on is how to prevent stones, as you've been asking. As of now, we both answered very confidently, we don't know how to prevent stones.
So it would be great if we know it.
In the future, we would have some answer to that.
Yeah, thankfully. So it was very amazing having a talk with both of you.
Thank you.
Thank you so much for giving your time.
Thank you.